Revealed. The 8 deadly threats after age 75. You can still avoid. Have you ever wondered what really causes most deaths after the age of 75? Are these causes inevitable, or is there something we can do to prevent them? What if I told you that 99% of deaths at this age are due to just a few specific conditions? Many people assume that dying at an advanced age is simply natural, but the truth is that most fatalities derive from avoidable risks. Risks that are often ignored until it is too late. The problem is that by the time most people realize what's going on, their health has already deteriorated and their options have become limited. But if you understand these dangers now, you can take steps to protect yourself and prolong your life in ways you never thought possible. In this video, we will reveal the 8 leading causes of death after the age of 75. Those responsible for almost all fatalities in this age group. Some may seem obvious, while others may surprise you. But one thing is certain: knowing them is the first step to preventing them. These are not just statistics. They represent real lives, real families, and real choices that can mean the difference between struggling with health issues or living a long and fulfilling life. Keep watching until the end, because these 8 causes are not inevitable. In fact, by making small but significant changes, many people have significantly reduced their risks. They remained independent longer and added years, sometimes decades, to their lives. The decisions you make today can determine how strong, active, and independent you will remain in the years to come. Let's get started. 1. The brain snatcher. How a stroke can steal your life in seconds. A stroke happens suddenly, without warning, and in an instant, life can change forever. It is one of the leading causes of death after the age of 75, but many people do not realize how many early warning signs and risk factors are within their control. The problem is that a stroke doesn't always give you a second chance. Once it happens, the damage is often permanent. But here's what most people don't know: up to 80% of strokes can be prevented. This means that the choices you make today can determine whether you will remain independent or experience a life-altering event. A stroke occurs when blood flow to the brain is suddenly blocked, or a blood vessel ruptures. When this happens, brain cells begin to die within minutes. The longer the brain is deprived of oxygen, the greater the damage. Some strokes are small, causing only temporary confusion or slight weakness. But others leave people paralyzed, unable to speak, or completely dependent on others. And in many cases, a stroke is fatal. One of the biggest risk factors is high blood pressure. Over time, too much pressure on the arteries weakens them, making them more likely to rupture or become blocked. And just like with heart disease, high blood pressure often has no symptoms. This is why so many people are completely unaware that they are at risk until a stroke suddenly occurs. Another important cause is irregular heart rhythms, such as atrial fibrillation, AAF. Many seniors experience this without realizing it, and when the heart beats irregularly, blood can form clots. If one of these clots travels to the brain, it can cause a stroke instantly. The good news: a simple medical checkup can catch these problems early, and treatment can drastically reduce your risk. And then there's the diet and lifestyle. Eating too many processed foods, excessive salt, and unhealthy fats increases the likelihood of strokes, while the lack of movement allows the blood to thicken and circulation to decrease. The best way to reduce your risk is to stay active, eat nutrient-dense foods, and maintain healthy blood pressure. Small changes like adding green leafy vegetables, reducing sodium, and drinking more water can make a huge difference. One thing that is often overlooked is mini-strokes, or TIAs, transient ischemic attacks. If you ever experience sudden numbness, difficulty speaking, blurry vision, or confusion, even if it goes away, don't ignore it. Seeking medical attention immediately can mean the difference between preventing a stroke and suffering its devastating consequences. The most important thing to remember: you have the power to reduce your risk of stroke. Checking your blood pressure regularly, maintaining a heart-healthy diet, staying active, and recognizing early warning signs can help you stay independent and avoid the life-altering effects of a stroke. The sooner you act, the greater your chances of protecting yourself. Did you know that many stroke survivors report ignoring multiple warning signs in the days or weeks before the main event? 2. The metabolic time bomb. Why diabetes silently destroys when you least expect it. Diabetes after age 75 is not just a blood sugar condition. It's a metabolic time bomb that silently affects every organ in your body. Many seniors don't realize they have type 2 diabetes until serious complications have already begun. The condition damages blood vessels and nerves over time, with no obvious symptoms in the early stages. For people over the age of 75, poorly controlled diabetes becomes especially dangerous. Kidneys begin to fail, vision deteriorates, wounds fail to heal, and the risk of heart attacks increases dramatically. Diabetes is particularly insidious because many mistake its symptoms for normal signs of aging. Constant thirst, frequent urination, unexplained fatigue, or blurry vision all are often dismissed as just getting old. But these are critical signs that your body is struggling with high blood sugar levels. Insulin resistance, the leading cause of type 2 diabetes, develops over decades. Your body gradually loses the ability to process sugar efficiently, resulting in organ damage that worsens over time. For someone over the age of 75, those years of accumulated damage can suddenly reach a tipping point. Diabetes also significantly weakens the immune system, making common infections potentially life-threatening. A simple foot infection can quickly progress to gangrene and amputation. A urinary tract infection can develop into a potentially fatal sepsis, and a common flu can turn into severe pneumonia. Blood glucose control becomes more difficult in old age, with medications often causing more serious side effects. Hypoglycemia, low blood sugar, becomes more common and more dangerous, leading to falls, confusion, and even brain damage. But there's good news. Even after age 75, lifestyle modifications can make a substantial difference. Regulating carbohydrate intake, staying physically active even with light exercise, and regularly monitoring blood sugar are essential steps. Studies show that even small reductions in blood sugar significantly decrease the risk of serious complications. Constant monitoring is crucial. Glycated hemoglobin tests every 3 months, regular eye exams, and daily foot checks can detect problems before they become serious. An integrated treatment plan with an expert healthcare team can effectively manage diabetes and prevent life-threatening complications. Remember, diabetes is a progressive condition, but not a death sentence. With proper control, people over the age of 75 can continue to live independently, actively, and healthily for many years to come. Don't let this metabolic time bomb determine your fate. Did you know that some studies show that even people with long-standing diabetes can partially reverse the condition with the right choices? 3. The fatal instant. The shocking truth about falls that no one tells you. One of the most dangerous and overlooked risks after age 75 is not a disease. It's a fall. It happens in an instant, a misstep, a moment of dizziness, a slippery floor, and suddenly everything changes. A hip fracture, a head injury, or even a seemingly minor bruise can quickly turn into a serious, life-threatening event. And the real danger, most people don't realize how vulnerable they are until it's too late. Here's something shocking. Falls are one of the leading causes of injury-related death in the elderly. They account for millions of emergency room visits every year. For many, a single drop leads to a decline from which they never fully recover. A hip fracture can mean months in bed, loss of independence, and a higher risk of infections and complications. But despite how common it is, most people don't take fall prevention seriously until they or someone they love experiences one firsthand. The problem is that as we age, our sense of balance, muscle strength, and reaction time gradually decrease. But because it happens so slowly, we don't always notice. You can feel good walking around your house, doing your daily routines, but then one day you achieve something, you lose your balance, and gravity takes over. The body simply does not recover as easily as it once did. And what used to be a minor stumble can now result in devastating injuries. And here's something that makes it even worse. The fear of falling leads to even more falls. Many seniors, after experiencing a near-fall situation, begin to avoid movement altogether. They stop walking, avoid stairs, and limit their activity out of fear. But the less you move, the weaker your muscles become. And the weaker your muscles become, the more likely you are to fall. It's a vicious cycle, and it can quickly rob you of your independence. But here's the good news. Falls aren't inevitable. In fact, there are simple but powerful ways to drastically reduce your risk. Strengthening your legs and core, improving balance, and making small adjustments to your home, such as better lighting, non-slip mats, and sturdy handrails, can mean the difference between staying active and independent or facing a life-changing injury. Another overlooked factor is the side effects of medications. Many prescriptions cause dizziness, drowsiness, or changes in blood pressure that make falls more likely. If you've ever stood up too quickly and felt dizzy, that's your body warning you that something needs to be adjusted. Talking to your doctor about your medications, making sure they're not working against you, and being mindful of how they affect your balance can save your life. Falling isn't just about tripping over something, it's about staying strong, stable, and aware of the little things that can make a big difference. Because after the age of 75, a single fall can change everything. And taking the right precautions today could mean years of continued mobility, independence, and a much higher quality of life. Did you notice that we have already listed 3 fatal threats, but there are still 5 equally dangerous threats to go? 4. Invisible invaders. How your body can become your worst enemy after 75. After age 75, your immune system is no longer the reliable guardian it was in your youth. Infections that would once have been easily fought can now turn into serious threats to life. This growing vulnerability is often ignored until a seemingly minor infection becomes a medical emergency. As we age, our immune system naturally weakens, a process called immunosenescence. Defense cells become less efficient at recognizing and fighting invaders, while chronic inflammation increases. This imbalance creates the perfect environment for serious infections to thrive. Pneumonia, often called the age-friendly, is particularly dangerous. What starts as a simple cold can quickly invade lungs already compromised by age. Pneumonia mortality in people over 75 is 10 times higher than in younger adults, even with modern medical treatment. Urinary tract infections, UTIs, also become much more dangerous. In the elderly, they often do not have the typical symptoms, such as painful urination. Instead, confusion, behavioral changes, or falls may be the only signs. Without treatment, a UTI can quickly progress to sepsis, a systemic infection with a high mortality rate. Sepsis is particularly devastating after age 75. When bacteria enter the bloodstream, they can trigger a cascade of responses that damage multiple organs simultaneously. The limited ability of aging organs to compensate for this stress means that sepsis can cause organ failure and death in a matter of hours. Skin infections like cellulitis become more common and serious due to decreased skin integrity. Small cuts or scrapes that would once heal quickly can now easily become gateways for dangerous bacteria. These infections can spread quickly, leading to hospitalization and serious complications. Gastrointestinal diseases, including Clostridium difficile infections, pose another substantial risk. These infections often occur after antibiotic use and can cause severe diarrhea, dehydration, and potentially life-threatening intestinal inflammation. What makes these infections even more insidious is that they often present atypically in the elderly. Instead of high fever, localized pain, or other classic symptoms, subtle changes like reduced appetite, increased confusion, or simply not feeling well may be the only indicators. This nonspecific presentation often leads to late diagnosis when the infection has already spread significantly. Prevention becomes crucial. Vaccinations against pneumonia, influenza, shingles, and COVID-19 are essential defenses. Meticulous hygiene, proper protein-rich nutrition, and good hydration strengthen your natural defenses. Proactive wound care, Even minor cuts or scrapes is essential to prevent skin infections. Perhaps most important is vigilance. Monitoring subtle changes in mental status, energy level, appetite, or functional capacity can lead to early detection. Seeking medical attention promptly, rather than waiting and seeing, can make the difference between a full recovery and a catastrophic outcome. Remember, invisible invaders show no mercy, but with knowledge and vigilance, you can strengthen your defenses and effectively face these silent threats. Time is of the essence when it comes to infections after age 75. Every hour counts. Have you ever imagined that your bathroom may harbor more bacteria that are dangerous to the elderly than an ordinary hospital? 5. When the air turns to poison, the respiratory collapse that many ignore until it's too late. Breathing is something we take for granted until it becomes difficult. As we age, our lungs don't work as efficiently as they once did, and even minor respiratory problems can become serious quickly. What starts as a simple cough or shortness of breath can lead to chronic conditions, infections, and even hospitalization. And after the age of 75, respiratory diseases become one of the main causes of death. Not because they are inevitable, but because they are often ignored until it is too late. One of the biggest dangers is chronic obstructive pulmonary disease, COPD, which includes emphysema and chronic bronchitis. Over time, the airways become inflamed, making it increasingly difficult to breathe. Many seniors dismiss symptoms such as frequent coughing, wheezing, or shortness of breath, assuming it's just a normal part of aging. But in reality, these are warning signs that your lungs need help. And then there's pneumonia. It may seem like just another infection, but for older adults, pneumonia is much more dangerous. What starts as a cold or mild chest congestion can quickly turn into a life-threatening condition. Because the body's ability to fight infections weakens with age, many hospitalizations after age 75 are caused by pneumonia. And in many cases, the infection leads to a rapid decline in health from which some never fully recover. Another major risk is poor air quality. Over the years, exposure to dust, pollution, and secondhand smoke takes its toll on the lungs. Even indoors, things like mold, pet dandruff, and indoor pollutants can worsen respiratory problems without you realizing it. And if you already have conditions like asthma or COPD, these irritants make the symptoms even worse. Making small adjustments, such as improving indoor air quality, using air purifiers, or avoiding smoke exposure, can significantly protect your lungs. One of the simplest but most effective ways to keep your lungs strong is to stay active. Many people don't realize that the lungs, like any other part of the body, need exercise to function properly. When you move, your lungs expand completely, keeping them healthy and eliminating mucus buildup. But when you sit for long periods, your lungs aren't working as hard, making you more vulnerable to infections and weakened lung function over time. Even light activities like walking or stretching can keep your lungs stronger for longer. Another crucial factor is receiving the right vaccines. Many older adults underestimate the importance of vaccines against pneumonia, flu, and other respiratory illnesses. But these simple precautions can dramatically reduce the risk of serious infections. It's not just about avoiding a bad cold, but about preventing complications that could land you in the hospital, or worse. A small step like keeping up to date with vaccines can mean the difference between a mild illness and a serious health crisis. Breathing should never be a struggle, but for many people over the age of 75, it is. Not because it has to be, but because they don't take action early enough. Your lungs are with you every second of your life, working to keep you alive. Taking care of them, strengthening them, and protecting them from infection is one of the most powerful things you can do to extend their health and independence. Take a deep breath. And now imagine what it would be like if every breath was a struggle. 6. Prisoner of one's own mind. The devastating truth about cognitive decline that everyone fears. Cognitive decline is one of the most difficult realities of aging. It doesn't happen abruptly, but rather gradually, starting with subtle lapses in memory or reasoning that over time evolve into something more serious. As mental function deteriorates, simple tasks such as taking medication, maintaining a proper diet, or recognizing symptoms of illness become difficult. This compromises not only the mind, but the general health of the elderly, and can lead to dehydration, malnutrition, domestic accidents, and loss of independence. Diseases such as dementia and Alzheimer's are life-threatening, and the greatest danger is that the initial signs are often ignored. Forgetting names, losing objects, or having difficulty following conversations is often seen as normal for the age, when in fact they can be important alerts. The sooner the problem is identified, the greater the chances of slowing its progress. Keeping the brain active is essential. Reading, learning new things, solving puzzles, or having a deep conversation help keep the mind in shape. In addition, physical exercise is as important as mental exercise. Moving increases cerebral blood flow, protecting memory. Social interaction is also vital. Isolation accelerates cognitive decline, while human connections help keep the mind sharp. Food also exerts a great influence. Foods rich in omega-3s, antioxidants, and vitamins strengthen the brain, while processed foods rich in sugar favor brain inflammation. Aging with lucidity and autonomy is possible. The decisions you make today, physical, mental, and social, shape brain health tomorrow. 7. The broken life machine. How your heart can fail when you least know it. Heart disease is the leading cause of death after age 75, but many people don't realize how much it can influence their heart health. The heart is a muscle that needs care to stay strong. Symptoms such as tiredness, shortness of breath, or sluggishness are not only signs of aging, but can indicate that the heart is weakening. High blood pressure is one of the biggest villains. It forces the heart to work harder without showing visible symptoms, which can lead to sudden heart attacks or strokes. Another important factor is food. Years of consuming processed foods, high in salt and bad fats, harm the arteries and circulation. And it's not enough to just avoid what is bad for you. It's essential to include heart-healthy foods. A sedentary lifestyle also contributes to heart failure. Standing still reduces circulation and muscle strength. Simple activities such as walking, stretching, or exercising while sitting already make a significant difference. The biggest mistake is to believe that heart disease is inevitable with age. The truth is that small daily choices add up to a big impact. Diet, physical activity, and stress management are essential pillars for a healthy heart. Studies show that even people over the age of 80 can strengthen their hearts. In other words, it is never too late to start. The best time to take care of your heart is now, because you have more control over your health than you realize. 8. The vital filters in collapse. The silent kidney failure that can shorten your life. Your kidneys are amazing filters that work 24 hours a day to purify your blood, but after age 75, their function can quietly decline. Chronic kidney disease, CKD, develops slowly, often without symptoms, until the kidneys have lost more than 75% of their capacity. That's why she's called the silent killer. The big problem is that the early stages rarely show visible signs, which makes early diagnosis a challenge. The main causes of kidney disease in the elderly are hypertension and diabetes. High blood pressure damages the renal blood vessels, while excess sugar affects the delicate filters of the kidneys. In addition, common medications, such as anti-inflammatory drugs, e.g. ibuprofen, antibiotics, and some blood pressure medications, can compromise kidney function when used long-term. Dehydration is also an important factor among the elderly, as many do not feel thirsty frequently. This puts a strain on the kidneys. Urinary tract infections, kidney stones, and urinary tract obstructions further aggravate the condition and can even lead to serious infections, such as sepsis. As CKD progresses, systemic problems arise. Swelling in the ankles, accumulation of toxins in the blood, uncontrolled pressure, mental confusion, anemia, fatigue, shortness of breath, and electrolyte imbalance, which can cause fatal cardiac arrhythmias. Despite the risks, there is good news. Even after the age of 75, it is possible to protect the remaining kidneys. Controlling blood pressure and blood sugar is key. Staying hydrated, drinking water even if you are not thirsty, and regularly reviewing medications with a doctor are also essential attitudes. Simple blood and urine tests can detect kidney problems early, such as creatinine, GFR, and type 1 urine. This vigilance is the key to intervening before the damage becomes irreversible. In addition to kidney health, it is important to remember that most causes of death after age 75, stroke, diabetes, falls, infections, respiratory problems, cognitive decline, heart disease, and kidney failure, can be prevented. Small changes in daily habits, such as eating better, exercising, getting preventive exams, and keeping the brain active, have a big impact. Consciousness gives power. Aging does not have to be synonymous with fear or fragility. With conscious and consistent choices, it is possible to maintain strength, mental clarity, and independence for many years. Reflecting on your own habits and making small adjustments today can make a big difference in the future. Taking care of your health at this stage of life is protecting what is most valuable, your well-being. This allows you to enjoy more time with loved ones and live with more quality. Every day is a new chance to make good choices. Start one step at a time and build a solid path to a longer, stronger, and fuller life.